Stomach cancer is an adenocarcinoma of the stomach lining. It is the second most common cause of cancer in the world, but in Canada it is less common. Cancer can be defined using 4 key attributes: proliferation without limits, evasion of apoptosis, acquisition of vasculature, and invasion of other tissues and metastasis. Proliferation without limits means that the cells forming the malignant tumor continue to grow without a response to inhibition from natural body processes. There are 2 types of genes that regulate cell growth: proto-oncogenes and tumor suppressor genes. Proto-oncogenes promote cell growth and tumor suppressor genes inhibit growth. If proto-oncogenes are mutated, they can act as oncogenes, which are tumor-inducing cells. If the tumor suppressor genes are damaged or mutated, cells will continue to grow abnormally. These mutations can arise from carcinogens such as chemicals, viruses, genetics, radiation, physical environment, nutrition, immunological causes, and causes that are unknown. In a normal cell cycle, one daughter cell re-enters the cycle, but for cancer cells, both daughter cells re-enter to be replicated. Normal cells undergo apoptosis, which is normal cell death. Each time a normal cell replicates, the telomere, a DNA code that serves to protect the genetic data and facilitates normal cell division, becomes shorter. When the telomere becomes too short, the cell is unable to divide further and dies. Cancer cells produce an enzyme called telomerase, which prevents the shortening of telomeres and allows the cells to escape normal cell death. Telomerase promotes an indefinite lifespan of cells and therefore has a role in the development of cancer. All tissues in the body require a vascular supply in order to acquire nutrients and for the removal of waste products. Cancer cells are the same in this regard, as they need vascularization to support their survival and growth. As the tumor increases in size, it is critical that it creates its own vascularization, known as tumor angiogenesis. This is facilitated by tumor angiogenesis factors that are produced by the cancer cells themselves. A regulatory function for proliferation for normal cells is contact inhibition. This means that cells do not invade the boundaries or territories of surrounding cells. Cancer cells are characterized by the loss of contact inhibition, which allows them to invade cellular boundaries and grow on top of or between normal cells. This allows the cancer cells to invade surrounding tissues, but can also be spread to distant sites, which is known as metastasis. A piece of the primary tumor detaches and enters the lymph or blood circulatory systems. It is then transported to distant organs where it extravasates into the organ tissues and can then start to proliferate and grow a secondary tumor. The common sites of metastasis are the lungs, brain, liver, bones, and adrenal glands.
There are 3 phases to the development of gastric cancer. The first stage is initiation, which is a mutation in the cell's genetic structure caused by genetics, errors in replication, or exposure to carcinogens. If the cell doesn't die or repair itself before cell division, the cell replicates into daughter cells with the same mutation. A single mutation is not enough to result in cancer. Promotion is the second stage of cancer development, in which the proliferation of the altered cells is reversible. Some factors are known to decrease the likelihood of reversibility to normal cell structure. Some promoting factors can include obesity, smoking, and alcohol consumption. As the number of altered cells increases in population, the likelihood of sustained mutagenesis increases. Progression is the third and final stage of carcinogenesis. In this stage, the cancerous tumor continues to grow, invade surrounding tissues, and metastasizes. Gastric cancer is an insidious disease where the cancer can spread along the gastric mucosal surface and penetrate through the stomach wall. The extensive lymphatic network in the stomach allows for distant metastasis, and in late stages, the seeding of tumor cells into the peritoneal cavity can occur. Stomach cancer can develop in any part of the stomach, the fundus and cardia having the poorest prognosis. Adenocarcinomas are the most common type of stomach cancer, accounting for 95% of all stomach cancers. This type of cancer develops in the mucosal surface of the stomach. The remaining 5% of stomach cancers are sarcomas.
Manifestations occur late in this disease when metastasis has occurred. Tumors can invade surrounding tissue and go undetected for an extended period of time. The most common manifestation is anemia, followed by symptoms identical to peptic ulcer disease or indigestion. Anemia can be caused by chronic blood loss from the tumor eroding through the stomach mucosa. Pernicious anemia can be caused by the destruction of stomach lining, causing loss of intrinsic factor. A person may present with pale skin and complaints of weakness, dizziness, fatigue, and in some cases, shortness of breath. Their stool may also be positive for occult blood. Perform a CBC to look for the size and color of the red blood cells, as well as hemoglobin and hematocrit values, which will be lower than normal. Complete a stool examination looking for melena or perform a fecal occult blood test. Inspect for paleness and assess for fatigue, dizziness, and shortness of breath, which can include vital signs such as O2 saturations and respirations. Stomach cancer can present as epigastric pain or dyspepsia, weight loss, dysphagia, constipation, nausea, vomiting, hematemesis, and gastric outlet obstruction. Ask about health history and perform a physical exam. Ask about the signs and symptoms associated with peptic ulcer disease and palpate stomach for masses beneath the abdominal wall. Weight loss may be apparent upon inspection. Hard and enlarged lymph nodes may be palpable. Endoscopy and biopsy are the best diagnostic tools because it allows for the most accurate detection of lesions or tumors in the stomach. Measure liver enzymes and serum amylase levels, as elevations may indicate metastasis to the liver and pancreas. Assess for tumor markers such as carcinoembryonic antigen, which is indicative of cancer. The complications of gastric cancer include pain, nausea, vomiting, weight loss, and bleeding. The growing tumor may cause gastric outlet obstruction and result in malnutrition and a change in bowel habits. The cancer can also spread to other sites such as the liver, where it may cause complications such as jaundice and ascites.
The interrelated concepts of cellular regulation are nutrition, pain, elimination, and fluid and electrolytes. Poor nutrition can cause the development of stomach cancer, and stomach cancer can lead to poor nutritional intake. Cancer cells can divert nutrients from normal cells to allow them to grow and thrive. Pain is a late symptom that presents as dyspepsia or indigestion. This is often undertreated because it is a common occurrence that many healthy people experience throughout their life. The gastric outlet can become obstructed due to achlorhydria, decreased contractility of the stomach, and physical obstruction by the tumor. This hinders the ability of the stomach contents to be eliminated. Vomiting can cause fluid and electrolyte imbalances by expelling large amounts of fluids and potassium from the body. This can lead to dehydration and hypernatremia. A chemotherapy drug used to treat gastric cancer is ramucirumab. This is an anti-neoplastic drug classified as a human IgG1 monoclonal antibody. Ramucirumab is used for the treatment of advanced or metastatic gastric cancer as a single agent or in a combination with other drugs. This drug is a targeted therapy that has been specifically engineered to attack cells with certain types of cancer antigens. It inhibits vascular endothelial growth factor receptor 2 or VEGFR2. It binds to and blocks to VEGFR ligands to inhibit the activation of VEGFR2 and thereby inhibiting the proliferation and migration of endothelial cells. This inhibition results in reduced tumor vascularity and growth. Ramucirumab is a relatively new drug, so the pharmacokinetics are not well understood. It is known that it has a half-life of 14 days with an excretion rate of 0.015 liters per hour. The desired therapeutic effect is to reduce tumor growth and vascularization. You can assess for this by palpating the stomach mass to note for any further growth. Performing an endoscopy can allow the healthcare provider to assess for inhibition of growth. Monitoring the progression of their manifestations such as nausea and fatigue may not produce accurate representation of positive treatment effects as they are side effects of this therapy. This therapy can cause fatigue, nausea and vomiting, thrombocytopenia, hypertension, hypoalbuminemia, abdominal pain, and decreased appetite. To assess for these effects, you can perform an interview asking about fatigue, nausea and vomiting, abdominal pain, decreased appetite, or monitor ins and outs if admitted. A nurse can assess blood pressure and conduct a CBC to assess for thrombocytopenia as well as a serum albumin test. Due to the side effect of thrombocytopenia, a nurse would want to assess for any unusual bleeding or bruising. They would also want to monitor the patient's blood pressure closely to prevent a hypertensive crisis. The nurse would also want to monitor for an infusion reaction, which could present as hypertension, diaphoresis, chest pain, and wheezing. A nurse would also want to give patient education on the drug. Gastric cancer is an insidious disease, and early detection is key for a positive prognosis.